Chapter 16, the endocrine system, the last and final chapter in the textbook and the last chapter that you will have to learn. So the endocrine system's job is to basically regulate different activities that the body does using chemical signaling, and those chemicals are called hormones. The endocrine system, releases these hormones into the bloodstream to kind of travel throughout the body, and then they can in turn influence things like your metabolic activity, your growth, and your development. Endocrine glands are considered ductless glands because they don't have specific ducts with which to release their hormones. Exocrine glands are ones that do have ducts. For example, your sweat glands and your salivary glands have specific ducts. So that's the difference between an exocrine and this endocrine system. So first off, we're going to identify the key organs and structures of the endocrine system and kind of what hormones that they produce and what those do, and then we'll get into the diseases and disorders and medical terminology. There's a series of glands throughout the body that are composed of the endocrine system, and this is when your diagram is going to kind of be helpful to go along with. Many of these are located in the brain. For example, your pituitary gland, your hypothalamus are both located in the brain area. The pituitary gland is kind of the key major player in the endocrine system. We also have the thyroid gland and the parathyroid. Those two surround the windpipe in the throat area. The thymus gland is a little bit lower down, kind of around the esophagus area. Then we also have adrenal glands. These sit on top of your kidneys, so you have two of them. The islets of Langerhans of the pancreas are other hormone secretors. And then finally the gonads, which could be the ovaries for females or the testes for males. All of these different glands produce different hormones that when released serve different purposes. So here's just the visual representation of where all of those glands are located, and you can see they're kind of throughout the trunk of the body, and then they get released into the blood as hormones and then travel throughout the entire body. So the heavy hitter of the endocrine system is really the pituitary gland. And it's called the Master Gland because the hormones that it produces then tell other endocrine glands to turn on or off and release their hormones. So that's kind of why it's a master gland. It tells the other endocrine glands what to do and what to release and not release. It's only about the size of a pea, and it's in the base of the brain, and there's actually two lobes. There's an anterior lobe and a posterior lobe. The anterior lobe produces a number of different hormones. For example, we have growth hormone, or GH, which, as you can imagine, is responsible for regulating the growth of the body. We have adrenocorticotropic hormone, ACTH, and its job is to stimulate the adrenal cortex. And we'll talk about the adrenal gland momentarily, but this hormone basically turns it on. We have the thyroid stimulating hormone, or TSH, which, as you can imagine, is responsible for stimulating the thyroid gland to release its hormones. There are gonadotropic ones. We have follicle stimulating hormone, or FSH, and luteinizing hormone, LH. So these are the ones that are found in men and women that are responsible for helping the ovaries and testes grow, which is why they are called gonadotropic. Lastly, for the anterior lobe, we have prolactin releasing, or lactogenic hormone. And hopefully you remember that lacto means milk. So this hormone, or these two hormones, really come into play during pregnancy and after birth to help a woman produce milk to nurse the baby. On the posterior lobe, there's two hormones that are released. One is called antidiuretic hormone. And an antidiuretic is something that helps reabsorb water. A lot of times when we eat things like coffee or soda, they're diuretics, meaning they kind of suck the water out of your body and basically make you pee more. So an antidiuretic is something that helps your body reabsorb a lot of the fluids, and that's what antidiuretic hormone does. It stimulates that reabsorption. And finally, oxytocin. Oxytocin is something that is kind of like the love-ish hormone. So it stimulates uterine contractions to help a woman give birth, but it also gives you that kind of, euphoric feeling or lovey feeling, when you see the baby for the first time or you're in love and that kind of thing. The hypothalamus is kind of the controller of the pituitary, if you will. It's a part of the brain that lives near the pituitary gland, but it basically tells the pituitary gland to turn on and or off. It helps stimulate or inhibit release of specific pituitary hormones that in turn go and stimulate other endocrine glands. The thyroid is the largest endocrine gland, and it sits right below the larynx in the neck area. And we also have something called a parathyroid, which are kind of four little nodules that are stuck inside the thyroid gland. But the thyroid produces two specific hormones, T3 and T4. If you really need to know their names, they're triiodothyronine and thyroxine, but you can just consider them T3 and T4. But these help in your growth, your metabolism, helping your body temperature and regulate your heartbeat. But a key thing to note is that your thyroid requires iodine to function properly. And that's going to come into play when we talk about disorders a little bit later on, and why we have things like iodized salt to be able to get that extra iodine we need for the thyroid to function. The parathyroid produces one hormone called parathyroid hormone, go figure, or PTH. And this one helps maintain calcium levels in the blood. So its job is to, regulate calcium, because you don't want to have too much or too little, and we'll talk about that later on. This brings us to the pancreas, where the islets of Langerhans are located, and it's just little clusters of tissue that are found kind of throughout the pancreas. It's not its own separate thing, and it secretes insulin, glucagon, and other enzymes that help in digestion. So a lot of you may know that insulin issues is kind of the key factor in diabetes, and we'll talk about that a little bit later on. But insulin is something that's released, when you eat certain foods. Same thing with glucagon. And it really helps and aids in the digestion process and nutrient absorption. So when you have that out of whack, then that's when we get certain medical conditions. The adrenal glands, like I said, they're located on the top of the kidneys. They look like little Hershey kisses, one on each kidney. The outside portion of it is called the cortex, and the inside portion is called the medulla. And this releases a few different hormones. One of them is called cortisol. It's also been called hydrocortisone, if you maybe have heard it as that. But this is the kind of fight or flight, if you will, hormone that gets released during stress. So when you get stressed out, it releases a whole bunch of glucose to give you a sudden burst of energy. It also releases aldosterone, and this is also secreted by the cortex, and it regulates certain electrolytes, so the sodium in the blood and the potassium in the blood, to keep your electrolytes in balance overall. And then the last one is secreted by the medulla. Again, this is also kind of fight or flight, epinephrine it's called, or adrenaline, norepinephrine, noradrenaline. It's 4 different names for really all the same thing. Most of the time it's called epinephrine. And this is again secreted when you're stressed out, but it increases your blood pressure, your heartbeat, your respiration, so it really gives you the jump start if you need to kind of run away in a stressful situation. And then the cortisol is giving the release of glucose you need to actually, burn the energy running away. Here's a good graphic that just shows you kind of, at least for the pituitary, where all the different hormones are going and what they are doing and what they are stimulating, and it shows kind of the targets and then what they will release. So it's just a visual to help you remember. Please make sure you try exercise 1 and 2 with the matching to match the gland up with the function, because that's going to be really important to understand that when we get to the medical terms. A few combining forms for the endocrine glands. They're pretty straightforward. So we have adeno, which we've seen before, and it's a generic term that just means gland. So you really could be talking about any gland throughout the entire body. Adreno and adrenalino is adrenal glands, so you're specifically talking about those adrenal glands. Cortico references the cortex, so the outside body of the adrenal glands, really the outer layer. But it could be really the outer layer of any organ. We just specifically were talking about the adrenal cortex in this chapter. Endocrino just means endocrine. Parathyroido, as you can imagine, is parathyroid. Pituitaro is pituitary. And in here we have thyroido or thyro, both mean thyroid gland. So there's no reason you shouldn't be able to get most of these just by naming the organ itself, or gland, excuse me. There are a few prefixes here and one suffix. Acro just means extremities or height. And this is going to come into play when we have diseases that are affecting growth hormone, because that's going to affect your height. Calci means calcium. So when we talk about how certain hormones regulate calcium, for example, the parathyroid, then we have calci. Dipso means thirst. When you have issues with your antidiuretic hormone, as an example, then you could be, more or less thirsty. So that's why we have dipso. Kali means potassium, and natro means sodium. So these are 2 electrolytes found in the blood, and they don't necessarily sound like what they are, but for you chemistry people, I just kind of remember or ask myself, what are the chemical symbols for potassium and sodium? And for potassium, the symbol is K, so then I remember Kali. And for sodium, it's Na, so I remember natro. The suffix drome means running or run. And the easiest way that I can think about it is I think of a syndrome. And syn, as we learned a long time ago, means together. So a syndrome is a bunch of symptoms that always run together. So if someone has a syndrome, it's a condition where there are a list of symptoms that usually all happen at the same time. So that's one example of when we're going to see that suffix. Which of the following contains the word root meaning potassium? It's either hypokalemia or hyponatremia. So in either instance, we're talking about hypo or a deficiency. Emia is the blood. And in this case, kali means potassium because the symbol for potassium is K. B would be if you had deficient sodium in the blood. So we are now to the diseases and disorders that are built from word parts. A lot of them, I'm not going to go through each one individually. You can, begin to put these together. But as you can imagine, there's a lot of ones with a prefix of hyper or hypo in regards to, too much or too little of a particular hormone. For one example, acromegaly, if you remember, megaly means enlargement, so acromegaly would be enlargement of the extremities and height. So this is a result of excessive growth hormone being released. Just a note here on hypercalcemia is excessive calcium in the blood. This kind of goes along, with all the other excessive things in the blood. For hyperglycemia, that would be excess sugar in the blood. Here, just so that you know, hyperglycemia is kind of one step below diabetic. So you would become hyperglycemic, and then if that continues or gets worse, then you get put into the category of diabetic, which I'll talk about a little bit later on. You can also have hypopituitarism, and what that just means, you can also, I guess, have hyperpituitarism, that one hormone secreted by the pituitary is malfunctioning either by having too little or too much. However, if you have panhypopituitarism, what that means is that all of the hormones of the pituitary are, deficient. So there's something wrong with the pituitary, so no matter what hormone it releases, it's not enough. So that's kind of the difference. If you add pan to the pituitary part, you're talking about all of the hormones it releases. However, if you just leave that off, then it could be one specific one that the pituitary is releasing. Now we're to the ones that are not built from word parts, and these are always the hardest to learn. So we have acidosis, and this is when you have a buildup of essentially of acid products in the blood. Or it could also be in the muscle tissue. So, when your body metabolizes certain things, there's an acid produced, and your body is normally supposed to get rid of them. However, when it doesn't, then you begin to accumulate them in the tissue. And usually this happens in people that have uncontrollable diabetes. Addison disease is a problem with the adrenal cortex. So in this case, if we remember, the adrenal cortex secretes two hormones. It secretes cortisol, which helps aid in body during stress, and then aldosterone, which controls the electrolytes. So therefore, these people have issues with weakness, skin issues, it could be depression, emotional issues, loss of appetite, a whole bunch of different things. And it's basically an eponym because it's kind of named after Thomas Addison, the first person who described this disease. Next, we have congenital hypothyroidism. So congenital meaning that it is a condition you are born with. And as it states, you have a deficiency with the thyroid. So the thyroid itself kind of is either gone or it begins to atrophy and waste away, resulting in no kind of functionality. So it can't secrete the hormones it needs to secrete, and then you end up with things like puffy features, even a mental deficiency, and dwarfism, because the hypothyroid can help with size also. Just so you know, it's also called cretinism because of the dwarfism aspect. Cushing's, or Cushing syndrome, is the result of excess cortisol. So the adrenal cortex releases too much cortisol, which is that stress hormone, and this could either be because of a tumor or some kind of hypersecretion, but it ends up in the individual having excess kind of pads of fat because the cortisol is releasing glucose in theory for flight or fight. However, you're not actually doing that, so you have this excess release that kind of pools on as fat. And it can even give you like a humpback, if you will. And there's a picture of it in your book, and I think maybe on the next slide I'll show you what that looks like. There's two types of diabetes: diabetes insipidus, or DI, and diabetes mellitus, which is DM. The traditional one that we think of is the second one. Diabetes insipidus is the result of decreased antidiuretic hormone, which means that you are excessively thirsty because you're not reabsorbing the fluids you need to, and therefore because you're not reabsorbing them, you have a lot of pee or large amounts of urine. And that's what diabetes insipidus is. It has to do with fluid control and antidiuretic hormone. Diabetes mellitus has to do with the pancreas and the islets of Langerhans not working like they should. So most of the time it has to do with underactive islets. So they're either not responding or not secreting the insulin when they're supposed to, or they're just malfunctioning because they can't. And that leads to elevated blood sugars because the insulin is responsible for breaking down those blood sugars, and if it's not, then it can't. And that's when you get hyperglycemia that eventually can lead to diabetes. Continuing on, we have giantism. So as you can imagine, this is, someone who is a giant or excessively large, and that's due to an oversecretion of growth hormone from the pituitary. A goiter, which I have a picture of a little bit later, is really due to a thyroid issue. It's a general term that really means enlargement of the thyroid, but this is because there is a lack of iodine. The thyroid needs iodine to function properly, and that lack of iodine leads to this goiter. Graves' disease is another thyroid condition, but here we have hyperthyroidism. So the thyroid is overactive, and it can produce things like goiter or what's called ophthalmos, which is abnormal protrusion of the eyeballs, and I'll kind of show you what that looks like in a little bit. Ketosis has to do with ketone bodies or excessive fat in the body, and usually this happens with diabetes mellitus, so it kind of goes off of the insulin issue or pancreas issue. A metabolic syndrome is just a group of signs and symptoms that usually include insulin resistance, so your body is no longer responding to insulin that is secreted, as well as obesity, hypertension, hyperglycemia, all kinds of blood lipid issues. And this usually leads to the development of type 2 diabetes. And I'll talk about what the different types are, I think, in a few slides, just so that you know. And metabolic syndrome is also called insulin resistance syndrome because your body becomes resistant to the effects of insulin. Next we have myxedemia. This is a deficiency with the thyroid, again, specifically in T4 thyroxine. So you have low T4 levels, and that results in hypothyroidism, which gives you a puffy face and hands, thick skin, slow speech, anemia, a whole bunch of other issues. Next we have pheochromosis. Excuse me if I re-say that, just so that you have it down. It's pheochromocytoma. I don't know what I said the first time. But it's a tumor on the adrenal medulla. Usually it's not malignant or cancerous, but it can cause hormone issues released from the adrenal medulla. And usually what happens is they surgically remove it, and sometimes if you can't, then it could be fatal. Tetany is, or think of like tetanus. It's a condition that affects the nerves, giving you spasms. So it is different than tetanus, but in this case, low calcium basically causes your muscles to begin to twitch or have spasms. So that's why it's important to keep up the electrolytes in your body. The last one is thyroid toxicosis, which is excessive thyroid hormones. And that's really all the book talks about there, but excessive T3s and T4s. A lot of these issues on this page are a result of the thyroid. It will be important for you to know which endocrine gland is affected in each one of these diseases. Here you can see an example of Cushing's syndrome. So on the left you have someone who does have Cushing's, and if we remember, that's when you are releasing excess cortisol, which is that glucose for fight or flight response. So you can see there's the excess fat buildup. On the right is the same individual, but in this case the person has been treated, and you can see they're returned more towards normal. Here's an example of what a goiter looks like. So this is a thyroid issue where you do not have enough iodine, so your thyroid is not functioning correctly, so it really enlarges, and so you get this big bulb kind of coming out of the throat area. So this slide is really more of an informational for you. I'm not going to put the different types in a testing situation, but type 1 is called insulin dependent or juvenile onset. This is typically the one that you are born with or develop very young in life, and the beta cells or the islets in the pancreas are destroyed somehow, some way. And so the idea is that you are not able to make the insulin that you need to break down glucose, giving you this diabetes mellitus. So what they typically do then is have insulin injections and special diets. These individuals probably have to wear an insulin pump or do daily shots or something like that. Type 2, which is actually 90% of cases and really on the rise, is non-insulin dependent or adult onset. And what that means is that in juvenile state, you had working islets of Langerhans and you were able to respond to insulin, but your body cells at some point have now become resistant to insulin. You just don't respond to it anymore, or your body has down-regulated and doesn't secrete as much anymore. And to kind of offset this, they really treat with diet, exercise, sometimes medication, and at some point, if your body is no longer secreting insulin, you might need to take some artificial form. And as I said, it's really on the rise. In 1985, there were only 30 million people, and then in 2010, now we have 285 million people. And weight and diet really do come into a key role in why those numbers have gone up, especially in the United States. These are the surgical terms that are built from word parts, and as you can see, almost all of them have ectomy at the end. So the answer to a lot of endocrine gland issues is to just remove whatever the gland is, and then at that point you would most likely take artificial hormones or take a pill that has the hormone that the gland was not secreting or the correct amount at that point. So you can have an adenectomy, which is really a very generic term and can be in a lot of chapters for excision of a gland, and then you can see how you would remove a number of different endocrine glands. There were no surgical terms not built from word parts, so that's good. However, there are diagnostic terms that are not built from word parts. So one of them is called a radioactive iodine uptake test, or RAIU. And this is another type of nuclear medicine test, so you would most likely take an radioactive iodine pill, and then your body would absorb that iodine as a measure to look at the thyroid, because the thyroid needs iodine in order to function properly. So then after a while you would then, look at the scans and see how well the thyroid actually did uptake the iodine. So if there's a low uptake, then that could be an indicator of thyroiditis or inflammation. If there's too much uptake, that could be an indicator of something like Graves' disease. Or if it's kind of all over the place, then that might mean you have maybe a nodule or a tumor or something affecting the thyroid. A thyroid scan is kind of similar, except instead of measuring a thyroid function and how it's working, it's looking at the size and the shape. And in this regard, it's more used for diagnosing growths, tumors, and nodules than really functionality. Finally, we have a thyroid sonography. So this is used to indicate whether or not, if a nodule is found, if it's cancerous or not. Because hormones are secreted in the blood, there's a number of different blood tests that can be done to kind of test for these hormones. So one of them is called fasting blood sugar, and this basically tells the amount of baseline glucose that's floating around in the blood. And it's called fasting because you need to not eat 8 to 10 hours before you have this test, because you don't want to artificially increase the amount of insulin secreted and decrease the amount of glucose just because you ate a meal. So this gives you a baseline, and if it's elevated, then it could indicate diabetes mellitus. Glycosylated hemoglobin is the next test, and this is another diabetes test because it indicates kind of the amount of blood sugar you have really over the last 3 months. So it gives you a longer history picture of your blood sugar, and it can do this because hemoglobin is on the red blood cells, and they live for about 3 months, so you can get a good picture of what that looks like. The next two are thyroid tests. Thyroid stimulating hormone levels, which are the T3, and that measures how much of it is in the blood to determine if you have hypothyroidism. And the thyroxine test for T4, if elevated, gives the indicator that you might have a hyperthyroidism, or if it's too low, hypothyroidism. Complementary terms built from word parts. The first one looks crazy long, but you just need to break it down into its components. So we have adrenocorticohyperplasia, which translates to excessive development, in this case of the adrenal cortex. But all the rest are pretty straightforward. Endocrinology is the field of study for particularly the endocrine system, and then the endocrinologist is the person. I will draw your attention to the prefix EU. We see that kind of sprinkled throughout the chapters, and that means normal. So euglycemia would be the normal level of blood sugar you're supposed to have, or euthyroid would be having a normal thyroid function. Polydipsia just means many thirsts if you translated it literally, but it means that you have excess thirst. And we already talked about what a syndrome was previously, but it's a bunch of signs and symptoms that seem to run together in a specific disorder. Complementary terms not built from word parts, there's really not a whole lot of them, but here they are. The first one is kind of creepy. Ex-ophthalmos. So if you remember, ophthalmo means eye from the eye chapter. And here we have just an abnormal protrusion of the eyeball, so they kind of stick out. And that is part or a symptom of Graves' disease. Other ones we have hormone. Hopefully you know that one by now, is a chemical substance secreted into the blood. Isthmus is what I have in the picture here below the eyeballs. An isthmus is a narrow strip that connects two larger parts. This could be, geographically there are isthmuses, but anatomically speaking, there is an isthmus located in between the right and left lobes of the thyroid gland. And then metabolism is a generic term, and it's the sum total of all of the chemical processes in your body. So when we talk about cellular metabolism, it's kind of all the different processes of building up, breaking down that take place in the body. Hyperglycemia can be detected by an FBS or a TSH. So first you have to know what those abbreviations mean. So FBS is fasting blood sugar, and TSH is thyroid stimulating hormone. And so the correct answer is A, because the fasting blood sugar will tell you what the blood sugar levels are, whereas B is going to be a measure of thyroid function. There are a lot of abbreviations in this chapter that you will be responsible for knowing. Most of these are either referencing a specific hormone abbreviation, a few of them are diseases, but there are a lot of them that are also tests, like FBS we just talked about, T3 test, or excuse me, TSH test, or F4 test. So just make sure that you have all these straight. And a key exercise would be exercise 33 to kind of work on that.